Hi, Dr. Mark here for Natural Health. Hope you're having a great day. It's been a beautiful day outside, and hope we get many more like this. Just as a reminder, we've been here now at Natural Health for 42 years, doing chiropractic and nutrition and dietary guidance. And to realize we are a chiropractic office so that we stay away from medication and drugs. Now, there is a place for that, but that also can cause some trouble too. So we're going to talk about that tonight. What an idiopathic treatment is. And idiopathic looks at, we just don't know what's going on there, but something happened. So as a leading cause of the top populated deaths in the US. So there's more than one reason, but there's things you can do about this one we're going to talk about that we do here all the time in Natural Health, what we can do to prevent it. So we'll get into it here. And of course, I'm Dr. Mark. I've been here for 42 years already, having all kind of fun, seeing lots and lots of patients with all kind of issues and things. And we've got really good at treating patients. Now again, we're a chiropractic office, so we work on neck and back pain and structural issues. That's what we started doing, but then also found out that nutritional work was needed, dietary guidance to help the adjustment stay, and even help the patient to be healthier and healthier. So the combination of the two, the chiropractic treatment, the nervous system working correctly, and then the nutritional work and dietary work, helping the body to handle the environment, really helps the patient to be healthy, be able to handle all kinds of stresses and things that we get into. So we're just going to talk about idiopathic, again, what's going on. So a lot of times there can be an illness or something, even a treatment that is supposed to work a certain way, but it doesn't work that way. So then we have a death or even a worse illness or that kind of thing. And that's caused by, in a lot of our information, by medication. Again, not prescribed, not meant to be a bad thing, but it just happens because medication is so strong. Medication overruns the autonomic nervous system and forces the body to work a certain way. Now, that's fine, and it should only be used short term, but the problem is the way the medical system is set up, it's compartmentalized. So one doctor does one thing, one doctor does another thing, and pretty soon you have people on 5, 10, 15, 20 medications. And then and nobody knows past two what the side effects of that are. Plus, the big point that people need to realize is that medication is not nutritional. It doesn't help the body to do anything to repair itself. It's just controlling a symptom or controlling a problem, whatever the illness is. Now again, that can be very beneficial short term, especially if it's a heart condition or some kind of thing like that that's very acute and very aggressive, and the medication is very important for that. But the trouble is that it's very strong stuff. And when you combine one with another, with another, with another, again, nobody even knows past two drugs at one time what the actual side effects are. And we see it all the time in our office here that everybody is individual. Everybody reacts differently to certain things. So when you put people on a medication and then don't try to handle the underlying cause of the problem, usually it makes the underlying cause worse because the body has to deal with all these chemicals in the body, and that can lead to a death or an illness there from that. So many of the patients we see come in that are on a lot of medication are on half the medication just to handle the side effects of the first medication. So you see a lot of that going on, especially if they've been on it for very long. So our goal here at Natural Health is to just not need to be in that paradigm. Now again, if you need medication for a certain thing, for an acute problem, that's very important, but not long term. Most medications really only meant to be used for 6 months. And we of course know people that have been on blood pressure medication for 40 years. Then they have congestive heart failure, but that's kind of another whole thing. So a lot of the side effects there. So our goal here again is to find out the underlying cause. We have patients coming in that are on the medication. We slowly work them off the medication as they don't have the problem that the medication was prescribed for. So you can help the body to heal itself. The body is meant to heal itself. It's meant to be well. It's done it for thousands and thousands of years. It's just in the last half century that we've gotten into this medication thing. Of course, it's big money. It's big business. What we look at it differently. We look at it where the body is meant to be well. It has all the natural innate intelligence to get itself well, but you have to remove the barriers. We call barriers in the office, things that get in the body that keep it from healing correctly. And we find really that the way we do things here, especially with nutrition response testing, is really the only way to find those barriers. The medical people don't even think about it like we do, and even out there in the natural world, there's very few techniques that even come close to what we do here as far as how natural response testing works to figure out the barriers. Now, an example of barriers would be like heavy metals, or infectious agents the body can't get over, or food allergies where the body's not absorbing good nutrition, chemicals, all kind of chemicals, even some scars on the body interfere with the nervous system, sort of just like the chiropractic misalignment or subluxation interferes with the nervous system. The body gets stuck, it can't heal. And so if you have that, and say for instance that might lend towards high blood pressure, well then you go to the MD, they put you on medication for that. Well, that's all fine and dandy for that short term, but you have to figure out, you really want to figure out what's going on underneath, because the medication will cause a side effect, because again, the body, it's not healing anything, it's just getting the body to handle the high blood pressure, which is important. And so then you have a side effect, put a medication, and another thing, as the body starts to deteriorate from one, not getting the correct nutrition because they didn't look at the underlying cause of the problem, and two, the medication is very hard on the body, the liver, kidneys, the body there in general, again, not handling the underlying cause. That's what we're looking at here when we look at the top 15 leading causes of death. What we're talking about now is going to be right in this group of accidents, unintentional injuries. So when the doctors prescribe medication, they don't prescribe it badly on purpose, but it just turns out that way. So that's an unintentional injury, which you could call an accident. So it's in the top 3 leading causes there. Now, diseases of the heart and cancer are things we also work a lot with. We've talked about that in the previous 2 Monday health shops, that there's a lot you can do to prevent that, prevent the disease of the heart and cancer issues. We even have a heart sound recorder that we use to figure out what nutrition the heart actually needs to strengthen itself. Again, an example I just talked about there, if you're on high blood pressure medication for a long period of time, that lends towards congestive heart failure. And so then you have a disease of the heart that's another big issue, if you can tell. So anyway, we're trying to look at what the underlying cause, and really with that, if you look at it like that, we can handle most all of these things here. Even something like intentional self-harm, that a lot of times is a lack of B vitamins, so the brain doesn't work right and people think weird. Or even if they're on a medication that's meant to control anxiety, there's a lot of side effects of different things. So we want to try to avoid that if we can do it at all. And that's what we do here at Natural Health, is look at the underlying cause of the problems, feed the body correctly, get the body to work the way it's supposed to, and it will heal itself. So hopefully that makes some sense, and that we can know that there is an alternative to being on medications, and you can get off of them, but you have to address the underlying cause of the problems and be willing to do that, willing to actually to look at that. So a good example is diabetes. They have it way down here. I think it's higher than that because it's it's growing faster and faster. But one of the major causes of diabetes is this overuse of refined sugars. I mean, it's just that simple. Now, again, people want to keep eating donuts and Pepsi all day, and they want to take medication. That's fine, but there's going to be a cost to that, because you're not giving the body well. You're just covering up a symptom, and eventually you'll have all kind of circulatory problems, vision problems, diabetic neuropathies and neuritis, and all kind of stuff that go along. Even if you're trying to keep it under control, the body will eventually break down. So again, we want to make sure and get the body, look at the underlying cause, get the diets handled, get the environment handled, get the body actually to working the way it's supposed to. That's what we do here at Natural Health. We work towards that goal. So I think that's enough for me. It gives you kind of an idea of what we do nutritionally to help that. So I'm going to turn it over to Dr. Chip. Don't forget, you can always sign up for our newsletter on naturalhealthquincy.com. We only send out once a week, so it's not overwhelming. We do have free consultations. So if you ever want to come in and just ask us what we do here, we're happy to help with that too. And hope you can have a great evening and a great week. We'll see you next Monday night, and we'll talk about more fun things. So I'll turn it over to Dr. Chip. Take it away.
All right, thank you very much. Okay, so we are talking about idiopathic. What does that mean? Well, again, idiopathic means that we don't exactly know what happened. Now, like Dr. Mark explained there too, the different things here with the unintentional injuries, some of those diseases or illnesses that we don't really know about, or they say that we don't know about, kind of fall into that category. They can, because again, they just don't know what's going on. And so they don't know how to treat it. They don't know how to get rid of the cause of the issue. And so we want to make sure to get back to where we're able to see things a little differently. Now, again, this kind of mode of operating here is more based on that your body needs these chemicals in order to live healthy. Now, we can tell that if that was truly the case, then there wouldn't be so much death and disease in here. So we have to actually take a step back and see what is going on there. Now, like we said, we explained there, is that these are not bad in and of themselves. In certain situations and serious issues, these can really help somebody to survive a certain circumstance or condition or anything like that. But in the long term, this is not an effective way to help a person to heal. So again, we want to make sure to talk about what we do know, not again all the things that we don't know. Again, just a little funny thing there, I don't know. So again, it's more of that idiopathic. It just kind of more means that they don't really know what's going on, and that's why they termed it idiopathic. So really, we want to make sure to get back to what we do know. And what we do know, or actually let's take a step back here again. Idiopathic, okay, now we have the actual definition. This is straight from, I think it's Webster's dictionary, but you can see relating to or denoting any disease or condition which arises spontaneously or for which the cause is unknown. And so a lot of times if you don't really understand how the body works, the biology, the physiology, how the brain functions, how the body, mind, the heart, everything functioning as a one system, again, you don't know what caused the issue. Now, a lot of times that we don't have to necessarily have to figure out what the heck or what really happened there or what caused the issue there, but we want to make sure to turn back to what we do know, and that your body is able to heal efficiently when it's balanced, when it's given the right things. And so we kind of always come back to this too, but again, chronic illness, the idiopathic falls into those categories. Again, it's just more of those illnesses that's kind of, you could spring out of nowhere or spontaneous. But again, usually it's due to these things being too built up and your body failing to adapt to things. So we talked about the chemicals and toxins, the traumas, and the negative thoughts and emotions. And so when we are not able to actually adapt to these things, then our body becomes unbalanced and we have a spontaneous thing going on. But really, if you think about it, it's just more of your body is not able to adapt properly to those stresses. These are just different stresses. And that, again, then it's a failure to become or stay healthy. And so again, those illnesses or diseases, again, that is one way to see it, that it is an illness or a disease. But if you think about another way, is that your body's natural normal state is health. And so when it becomes unbalanced, there is a dis-ease, there's a dysregulation, and there's a disharmony. When your body is healthy, there's harmony. All the systems are working properly, all the cells are working together, everything's functioning optimally. But when there's disharmony or dysfunction or dis-ease, then that means that something is throwing it off too much. That means that something is getting overloaded or your body's just not able to adapt. And so we just want to go back, we have to make sure to get back to how we can see the body and how we can see it as health being or more of a natural state. And so again, from chronic illness to wellness. We talk about nutritional, physical, mental, emotional, and balance. And so like Dr. Mark explained there too, is that when we're able to work with these, we know that it can help in different areas. there's a lot of research out there, there's different things there. But again, if we work out, if we're moving our bodies, everything, we know that that is good for our mental health. We know it, we feel it, we can understand that. Nutritionally, if we're always eating different processed foods, sugar, all that, we know that in our physiology, that that chemical, that sugar or different foods like that can actually play factors on our gut, and that can cause us to think differently, to have different emotions, all that too, because a lot of your neurotransmitters are, brain chemicals, or but it's called serotonin, all those different things. They're made in the gut, so we want to make sure that we're able to help our body as a whole to support it, in the whole sense there. And so that's why that can be a factor there. So it's the balance of all of these things that can really promote ourselves to be very good, be able to help our bodies to adapt very well. So it always comes down to balance there. So nutritionally, of course, too, is that we want to make sure to eat good, healthy, whole foods. We have a lot of the information out there about what foods to eat, what's going on. We kind of tend to get so worried and caught up about calories and making sure we're hitting the macros and all that. But if we just go back to the basics of eating good whole foods or fruits or vegetables, different meats, good proteins, we've got to go back to what we've been doing for a long time to help maintain our health. Now, again, the fruits and all that too, there are different things that if we are eating too much sugar all the times, or if we're diabetic, all that, the fruits can have a factor because your body just can't handle that sugar. But again, we have to be able to know that and recognize that, because that's part of how our body works, our biology, our physiology, all that too. Physical, again, we know that we need to move our body. Number one, we need good rest, sleep, but we also need creativity, play, all that. We need to be able to, recreation, because again, a lot of times too, is if we work out, we're not doing the things we enjoy doing, then that can be a factor there too. So we want to make sure that we're doing, able to do all these things. And then the mental and emotional, like we said too, is that they all play factors within each other. They're all overlapping there too. So they all work together. But again, mental and emotional there too is get out in nature, walk on the grass, do something different, fresh air, sunshine, all that is always good. Reading, learning different information that helps to actually create different neural networks in our brain. And then journaling, again, it's just another way of helping get our thoughts on paper. But then again, that's a process just to help ourselves to kind of get out of our heads and get back to the kind of the present moment there too. So a lot of times, again, a lot of good things there. We want to make sure that we're able to you don't have to do everything. You don't have to get so crazy about it, but just pick one thing to help yourself. It can be even 10 to 15 minutes a day. Again, just kind of starting the ball rolling to where you're helping your body to adapt better. And so again, in here in the office, we are a chiropractic and nutrition office to help support your body, to help it to self-heal and self-regulate. Again, we're always supporting your body's health. We're not forcing anything. We're not doing anything to make sure that we're pushing and pulling. We are really just allowing your body to do what it needs to heal. And that's what really is all that it's about, is getting back to normal. Health is normal, and we're just wanting to get back to that state. So again, these are two factors there. Now, of course, too, is that we'll have pains. We can have aches. We can have different things like that. Pain in your neck, low back, all that stuff. It just means that your body got unbalanced to a point. We just want to make sure to balance that back out, get everything cleared up. That's what chiropractic is good at. But again, it's actually good for helping your body to heal as a whole. Now with the nutrition there too, it's just the supportive factor to really bring everything together and really get you to where you're able to heal well and heal more efficiently. So you can see there too, a balanced brain and body, chiropractic wise, we want to make sure that everything is working in harmony. We want to go from dis-ease to ease, from disharmony to harmony, and making sure that your body is able to heal sufficiently and efficiently. So again, that is all we have for tonight's Health Shop. So again, Natural Health Quincy IL. You can see it, or you can search for it at Facebook, YouTube, Brighteon, and Instagram. Please subscribe to our email list at naturalhealthquincy.com for more information. You can always reach us here at the office at 217-228-2040. We're located at 2000 Jefferson Street in Quincy, Illinois. Again, we're just really want to help people to understand more about how they can help themselves, and then we're here to help them in any part of your healing journey. So thank you again so much for your time, and have a great rest of the week.